When you watch chiropractors on TV or YouTube, some of that stuff looks painful or like they're hurting someone. How do you go about treating people without hurting them, or why does it look so rough?
Chiropractors we are extensively trained. If you're practicing in any state in the United States, and actually most countries, is that you've gone through exhaustive training and passed all, several levels of boards and things of that sort. But just a little quick, insight into our education process. Obviously, it's the anatomy, physiology, all that stuff to start, the book work. Well, then we go into spinal analysis, where you have an entire semester of you're just touching the spine, you're just palpating, and you're ultimately just acclimating with what's normal, what's not normal. And then we go into an entire semester of what's we call setup. And so you take those joints to their end range, but you don't actually get to manipulate. So you get to feel where those joints are supposed to move, how they're supposed to move, what directions they're supposed to move. And then once you have accomplished that and you've started to become an expert at the way that the joint planes are designed, then finally you get to get into manipulation. But this is what I tell people all the time. Anatomic limit is where a bone fractures. Physiological limit is where you can actually move yourself. Chiropractors take you past the physiological, but not to the anatomical, and so that's where the adjustment takes place. And so I get the question all the time, well, I adjust myself. You can't, because it's a passive moment. It's a passive movement. And so you're unable to adjust yourself. If we're talking about what an adjustment is, it's someone else passively taking you past that physiological limit and making your joint mobilized to basically increase the function and maximize the optimal function of that joint. Whereas if you're doing it yourself, you're only actively doing it, taking you to the physiological limit. So there's a big difference, but no, we're not able to take it to the anatomic limit. The movies have done us an injustice where it makes it look like it's very easy to fracture a spine and fracture a neck and something like that. But fortunately, we're very well trained, and it has become where it's second nature at this point, and we're able to palpate, feel those joints, and ultimately release it and restore function.